Do you remember the last time you struggled to catch your breath? Perhaps you dove into the bottom of the pool, and as you kicked to the surface, you felt your lungs burn for air. Or you were playing a sport and you got thumped in the chest, knocking the wind out of you. There's that terrifying moment of panic, and then thankfully, you breach the surface of the water and your lungs remember to work. You can breathe. For you, that moment may have been yesterday or last summer, or maybe you haven't been foolhardy enough to dive in too deep since you were a child. But for 4 million Americans living with chronic obstructive pulmonary disease, or COPD, they experience that struggle to breathe every day.
COPD stands for chronic obstructive pulmonary disease, and that is a term that encompasses a number of different lung diseases that are joined by the fact that it's hard to get the air out. So anything that lasts a long time, meaning chronic, so it's not something that happens and goes away in a short period of time, like a month or two, that makes it difficult to get the air out of the lung. About half the people who have COPD in the United States, which is a relatively wealthy, advanced country, don't know they have it and are not in the medical system. A lot of people think, for example, that they're not breathing very well, or they can't do the activities they usually do because of aging or weight gain, or they have a sedentary lifestyle, when in fact they have actual difficulty moving air in and especially out of the lungs.
Most COPD patients have a bit of both bronchitis and emphysema, though one may be more at fault for the shortness of breath than the other. Bronchitis causes inflammation and narrowing of the airways that lead to the lungs. Emphysema damages the tiny air sacs in your lungs called alveoli, which exchange oxygen and carbon dioxide. So either the air isn't even getting to the lungs, or it's being trapped in the lungs before it can service the rest of the body. In all cases of COPD, the destruction inflicted on these important lung structures is the result of long-term damage.
The typical example is in smoking-related lung disease. There's damage that they can get over, but at some point you reach a point of no return where it will be long-term damage. There is scarring initially, and then actual destruction of air sacs and bronchial tubes that lead to lifelong problems. It used to be thought that COPD was exclusively caused by smoking, but we now know that at least worldwide, only about half the cases of COPD are caused by smoking. There are many other problems totally unrelated to smoking that can cause COPD.
Common COPD symptoms are shortness of breath, wheezing, chest tightness, and chronic cough. Unfortunately, everyone has these from time to time, so people don't seek medical attention until those symptoms are persistent. And those symptoms aren't persistent until there's been significant lung damage. That damage occurs and worsens over time.
Another important feature is it's understood that COPD not only affects the lungs, and this is why it's so important to diagnose it, it is a risk factor for cardiac disease. It creates inflammation that spreads over to the coronary arteries, causing blockages. It's a risk factor for strokes, and also a risk factor for cancer, particularly lung cancer. So it's very important to know about it so that these other complications can be dealt with. Because it's a systemic disease and you have these recurrent infections.
COPD treatments consist of a combination of relieving symptoms, reducing risk of complications like pneumonia, and preventing progression of the disease. Quitting smoking is always step one. Then, there are some things you can do around the house to help you breathe easier. Eat a healthy diet, avoid very cold air, and reduce air pollution by eliminating secondhand smoke, fireplace smoke, or other irritants like dust or chemical fumes. There are also medications like bronchodilators and inhaled steroids.
The use of these bronchodilators, there's some special types called anticholinergics, and those drugs, as well as the inhaled corticosteroids, the inhaled steroids, reduce that rate of infection, which has effects on the heart and the lungs and the brain and the muscles. So there are a number of drugs that we can use. I should mention, since it is influenza season, that one of the most common reasons for people getting into serious trouble with COPD, which includes asthma, emphysema, chronic bronchitis, and bronchiectasis, is influenza. Influenza can affect the lungs directly or set up a series of events that predisposes to pneumonia. And heart attacks are very common during influenza attacks and strokes. So it's important to follow up with immunization. We also have pneumonia vaccines that cover pneumococcus, which is the most common and serious complication of influenza. So vaccination, very important in reducing the complications of COPD.
Another wonderful COPD aid is exercise programs, especially pulmonary rehabilitation. These programs last around 8 to 10 weeks and are run by a group of healthcare professionals, including physical therapists, respiratory therapists, and exercise specialists. They provide more information about COPD, helpful nutrition, medications, and safe exercise regimens, which will improve the efficiency of the cardiovascular system. Then, every breath will really count. I'm Dr. Mike Rosen, and you're watching the eHealth Network. See you next time.